Sorry about that, video cut out. So we'll pick up where we left off. We were talking about free nerve endings in the pulp of your teeth, and that how any sort of stimulus is going to trigger those free nerve endings, and those would be something that are very slow to adapt because that just never stops responding to that stimulus. But you do have free nerve endings other places in your integumentary system that will adapt. So you have examples of both within the body. Now, where you would find these in the skin, so not just in the tooth roots, but in the skin where they would be more likely to adapt than they would be in the tooth roots, would be in the dermis, so kind of deeper in the skin. But then they also go pretty high up into the epidermis, so all the way up into the stratum granulosum, so into the last living layer of the epidermis. Now, another type of fine touch and pressure receptor that you have in the skin are the Merkel cells. These are slow adapting, so they'll just keep responding to a repeated stimulus. They're very specific in terms of what they will respond to, so they are not polynodal. They have a connective tissue capsule that helps them be more specific. And what they're specific to are textures. So they can tell the difference between like a smooth surface versus the surface of the paper, which is also smooth but slightly different, or the surface of the pen, or if you were to, have a piece of cloth nearby, they can tell the difference. That's how you know the difference, is because Merkel cells respond to that. So where you find these are in the bottom layer of the epidermis, the stratum germinativum, but they're only found in parts of the body that are glabrous, Glabrous. What that means is hairless. So there's not that many glabrous parts, truly glabrous parts of the body. There are fine hairs in most of the parts of your body, but your lips, the palms of your hands, the soles of your feet, those places are completely glabrous, and that's where you'll find the Merkel cells. And then our last type of fine touch and pressure receptors are Meissner's corpuscles. These are fast adapting, so these are the ones that are responsible for sensing your clothes going on. They're just regular old touch, just really sensitive to any sort of touch. But they will stop responding to that touch after just a short period of time. They are encapsulated, so that does limit their sensitivity a bit, but they are still quite sensitive. And you find these in the dermis of the skin, so they're slightly deeper in the skin, under the epidermis. But you find lots and lots of these Meissner's corpuscles in sensitive parts, like in the face, the fingertips, things like that. So the more sensitive an area is, the more Meissner's corpuscles there are. Now, for the crude touch and pressure receptors, there are two examples. The Pacinian corpuscles, which could also be called lamellated corpuscles, just depends on your preference really. On the test I could use either. I tend to prefer Pacinian often, but be ready for lamellated in case you do see it that way. So these are quick to adapt, so they'll stop responding to a repeated stimulus. They are specific to a stronger pressure, so a good indent on the skin. So a stronger push is required for a Pacinian corpuscle. They are encapsulated, so that helps to limit their sensitivity to a lighter pressure. And you find these in the dermis, so relatively deep, and then also in joint capsules. So surrounding, like any joint where your bones are coming together. So like your knees or your elbows, shoulder, hips, things like that. And then we have our Raffini corpuscles. These are slow to adapt, so they'll keep responding to a repeated stimulus. These are specific to stretch only, so you find these in glabrous parts, so hairless parts. So think of like the palm of your hand, and when you're holding onto something. So I'm holding this pen, and then I'm pulling it out, and I can feel that I'm losing my grip on the pen. So anything that you're holding, and if you start to lose your grip and it starts sliding out of your hands, you'll notice that, and that's because of the Raffini corpuscles. And if you just kind of look at this as it's pulling out of my hand, it's pulling on the skin, it's stretching the skin, so it's sort of like pulling it a little bit. And that's what those Raffini corpuscles are reacting to. Now there is a connective tissue capsule around the Raffini corpuscles, and you find these really deep. In the glabrous areas, they're in the dermis, so relatively deep, but you'll also find them in the hypodermis, so under the dermis even, so not exactly part of the integumentary system at all, but just right below the integumentary system. Okay, so that is it for our touch and pressure receptors. That's it for Unit 2 in terms of the videos too. So make sure, for the lecture part anyway, so make sure that you have read all of the notes, that you've viewed all of the videos, and you should be good for Unit 2.